Hi, my name is Angelica Musumeci, and this is my Family Nursing Theory presentation on Family Systems Theory for Nursing 714 Family Theory and Health Promotion. The objectives for this presentation are to present key concepts of family systems theory, explain how these key concepts are linked, provide definitions that are pertinent to the theory, analyze how the theory is applicable to family nurse practice or family care, and discuss two research projects that have been guided by the family systems theory. Family systems theory views the family as a whole, while individual family members influence each other. This theory is used by nurses to assess and understand how families are organized as a cohesive unit. The theory can be used to look at the family as a whole or at the individual who is a part of an interactive and connected system. Key concepts of the family systems theory include all parts of the system are interrelated. Therefore, if one part of the system is influenced, then all parts are altered. Such is in the case if one individual family member becomes ill. The entire family will be affected by this occurrence. Another concept of the family system theory is that the whole is greater than the sum of its parts. The composition of the family is made up of more than just individual lives. The relationships that are assessed in this theory are viewed together rather than separately. The third key concept of family systems theory is that all systems have some form of boundaries between the system and its environment. Families have the ability to protect individual family members or the entire family by controlling the information and people that come into the family system. These borders that are made can be physical or imaginary. Boundaries can be closed, flexible, or too open. An example of a closed boundary is a family refusing help from others. Flexible boundaries can be controlled to selectively open or close depending on the situation. A family that has two open boundaries allows the family to let anyone know their family situation, and it allows them to be non-selective of the quality or quantity of resources they invite. Lastly, systems can be further organized into subsystems. Subsystems include relationships within the family system, such as mother to child and child to child. These subsystems use the three family dimensions, structure, function, and processes, which help nurses formulate interventions that create positive outcomes for the family. The four main concepts are linked as they center around the process of each family system. To better understand how the concepts are linked, we can use an example of a family of four, which consists of a father, mother, and two children. Consider what would happen if the mother became suddenly ill. As we look at the first main concept, which states that all parts of the system are interrelated, we can consider how the entire family will be affected by this unexpected illness. For instance, now that the mother cannot be the primary caregiver, who will accomplish her daily roles for this family? Roles may have to change. The second concept, the whole is greater than the sum of its parts, directly relates to this concept as it focuses on more than just the individual who is experiencing the sudden illness of their mother or wife, but how the entire family is experiencing the stressful situation. They may wonder how their family will cope if their mother or wife dies. Concepts 3 and 4 exist to help us better understand how the family system operates. Each family system has boundaries, whether they are closed, flexible, or too open, which affects the family experiences as a whole. Subsystems that look at relationships amongst the family system, such as child to child or mother to child, are important to consider since the structure, function, and processes within these relationships can directly affect the family system. In this example, we can look at the relationship between the mother and child. What will happen to this subsystem and how will it affect the family as a whole? Will the family be open to seeking medical treatments to help the mother? And if not, how will the relationship change between the mother and child? These boundaries and subsystems exist to help the family to operate either functionally or dysfunctionally. The family systems theory contains four definitions, which include family, health, environment, and nursing. The family is a relationship and emotional system that is viewed as a whole entity made up of mutually dependent persons who influence each other at individual, systemic, and intergenerational levels. Health is defined by the family. It is a family view that will affect the entire family system. As the family is viewed as a whole, if illness occurs in one member, it will affect the entire family system. Since the majority of emotions are influenced by the family has the capability of helping the other family members to heal better in comparison to an outside member of the family system. The environment is defined as the surroundings or conditions in which the family adapts, functions, and operates in. The family can change based on the stressors from internal or external environments. The family also has the capability of creating boundaries between the family system and the environment based on those stressors. Nursing is defined by the family. Nurses must view individuals as members of a family system, and nurses must provide care from a family perspective rather than the individual to help the family reclaim or maintain stability. The family systems theory is applicable to nursing practice in several ways. Evidence-based literature reveals that by using family systems theory as a framework, nurses can understand how proxy decision-making happens in the clinical setting and how it impacts the family before, during, and after decisions are made. In one study, specialty care service centers use this theory to help identify high-risk families experiencing dysfunctional processes, such as communicating and problem-solving issues, that may become more problematic as the family begins to reach the stages of proxy decision-making. By identifying these dysfunctional family systems, the nurse can facilitate advanced directives and proxy-related discussions that will aid in optimal care for both the individual and family. Evidence also supports the use of this theory in the multidimensional treatment of childhood obesity to influence weight-related behavioral changes from a family dynamic perspective. The theory has also been used to identify those at risk of developing generalized anxiety disorder and romantic relationship distress by addressing their inability to regulate relationships related to experiencing childhood familial abuse or violence. One research project that has been guided by family systems theory is the randomized controlled trial that evaluated the effectiveness of the family systems theory on marital conflict in family nursing practice. The study randomly selected 42 couples that were attending family court in Shiraz, Iran. The intervention focused on the utilization of Bowen's family system theory in 8 90-minute therapy sessions. During these sessions, conversations regarding current issues amongst the family and between the couple, dysfunctional relationships, and roles in the family process were encouraged and discussed. The overall goal was to identify developmental and situational stressors based on patterns that the family was experiencing. By gaining this information about the family's emotional process, the nurse practitioner could further highlight these patterns so that the couple had a better insight as to why the family system process was dysfunctional. A pre-test and post-test was provided to both the intervention and control groups. The tests were formulated using a marital conflict questionnaire. The results found that the intervention group who experienced the therapy based on the family systems theory had decreased marital conflict immediately and 1 month afterwards. Another research project that has been guided by family systems theory is a pilot study that evaluated the efficacy of internal family systems therapy, which is derived from family systems theory, as an alternative approach to treating depression. The study chose 32 college females between the ages of 18 and 27 with mild to severe depression. Each female would participate in one 50-minute therapy session per week for 16 weeks. 17 women received internal family systems therapy, which focused on how the individual cannot be fully understood unless taking into account parts of themselves that have various qualities and roles. During this intervention, techniques were developed to address problems within the patient's family or community. The therapist would learn how the different parts of the individual functioned as a system to increase coping skills and conflict management. The other 15 women received treatment as usual, such as cognitive behavioral therapy or interpersonal psychotherapy. Measurements included the Beck Depression Inventory that measures depression symptoms, and the revised Helping Alliance questionnaire that indicated how strongly the patient felt about their relationship with their therapist. Results of the study showed that there was a decline in depressive symptoms using the internal family systems intervention, yet there was no significant difference in the rate of change between the internal family systems intervention and the treatment as usual. However, since the internal family systems intervention did yield similar results to what is known as the gold standard treatment for depression, this shows promising results for future use. In summary, I have chosen to use the family systems theory for my family assessment assignment to help understand a family as a connected system. I will use this theory's major concepts to help look at the family and its subsystems to gain a holistic perspective. I believe this theory will be most helpful in assessing the family I have chosen due to the fact that the family is quite large, and I find it may be more rewarding to look at the family system as a whole rather than the relationships between each family member. Also, a strength of the family systems theory is that it offers the use of a family genogram to get a clearer picture of the family, which will also help to better understand how the family operates as a system.